session is called Implications of Medical Tourism in American Healthcare, and we're pleased to have three excellent representatives from three American organizations. We have Dr. Joseph Heyman, who is an obstetrician and gynecologist with a private practice in Amesbury, Mass. He's been a member of the American Medical Association Board of Trustees since 2002. He served as its secretary and was chair of the Finance Committee. In June 2008, he began serving as a chair of the AMA BOT for 2008 and 2009. We also have Dr. David Preble, who is director of the American Dental Association's Council on Dental Benefit Programs. He practiced general dentistry in both private practice and public health settings for over 20 years before coming to the ADA, and is a fellow of the Academy of General Dentistry. He graduated from Marquette University in 1976, Georgetown University Dental School in 1980, and St. Thomas University School of Law in 1994. We also have Dr. Michael McGuire, who is a board-certified plastic surgeon in private practice in Santa Monica, California. He is an associate clinical professor of surgery at UCLA. A past president of the California Society of Plastic Surgeons, Dr. McGuire is currently vice president of the American Society of Plastic Surgeons. So we're going to start with a presentation from Dr. Heyman.
Thank you very much. It's a great pleasure to be here. I guess the first thing I would say is that for most American physicians, we don't have a clue about medical tourism. The American Medical Association probably started looking at this no more than about 6 months ago. So this is all new to us. Our perspective is that one of the reasons that there is medical travel and medical tourism is that there are lower wages for physicians and other healthcare workers in other countries, that there's a different kind of pricing in different countries, there's less involvement by third-party payers in other countries, and substantially lower litigation costs, and less cost shifting from patients who don't have coverage to patients who do have coverage. We see within the United States, and I think it's a generous thing to say it's inconsistent price transparency. There practically is no price transparency. There are excessive regulatory costs. Everybody is asking every hospital to report on everything, and it becomes very, very difficult. And there, of course, are still excessive costs from medical liability. We have uncompensated physician charity care. I mentioned the cross-subsidization before. And while health insurance protects against the unpredictability of costs, it also allows the patient to be immune from knowing what those costs are. Now, the AMA, you may be surprised to know, has a policy that indicates that patients should have choices. And so the American Medical Association would view medical tourism and medical travel as one of those choices. We don't have a policy against medical tourism or medical travel. And most of us, when we think about medical travel, we usually think about royalty from the Middle East coming to a hospital in Baltimore or Massachusetts or San Francisco for their care. Most of us haven't thought much about people traveling from one country to another in the volume that we know is existing now and which will surely increase over the next several years. We also know that there's been a change in bankruptcy rules in the United States, that insurance premiums are going up. The number of uninsured until very recently was increasing, and we still have 47 million of them. Language barriers are dropping by the wayside.